Hello, my friends. I'm Dr. Armen, Professor Armen Astvatsatryan from Yerevan, Armenia. So you're on the Dr. Y channel. My dear students, take your pens, papers. So we continue to talk about your big exams questions. And all questions today are around thyroid dysfunction, thyroid disorders. So why pens, why papers? To make the notes, of course. Anyway, I'll be listening these videos several times. And we go. There we go. Let's go. So, thyroid disorders are medical conditions that affect the function of the thyroid gland, a butterfly-shaped gland located in the front of the neck. The thyroid gland produces hormones that regulate various metabolic processes in the body. When the thyroid gland becomes overactive or underactive, it can lead to a range of symptoms and health problems. For example, hyperthyroidism, hypo and hyperthyroidism, goiter, thyroid nodules, thyroid cancer. So hypothyroidism, this condition occurs when the thyroid gland doesn't produce enough thyroid hormones. Common causes include autoimmune disease, so-called Hashimoto thyroiditis, radiation therapy, thyroid surgery, and certain medications. Symptoms of hypothyroidism may indicate fatigue, weight gain, constipation, cold intolerance, dry skin, depression, and muscle weakness. Vice versa, hyperthyroidism is the opposite of hypothyroidism, characterized by excessive production of thyroid hormones. So that's why it's hyper, not hypo, hyper. So Graves' disease, an autoimmune disorder, is the most common cause of hyperthyroidism. Symptoms can include weight loss, rapid heartbeat, anxiety, irritability, tremors, increased sweating, heat intolerance, and difficulty sleeping. Goiter is an enlargement of the thyroid gland, often causing a visible swelling in the neck. It can result from both hypothyroidism and hyperthyroidism, as well as iodine deficiency. Most goiters are painless, but a large goiter can cause difficulty swallowing or breathing. Thyroid nodules are lymph or abnormal growth that form within the thyroid gland. They can be solid or fluid-filled, and while the majority are benign, some nodules can be cancerous. Thyroid nodules may cause no symptoms or can lead to symptoms such as difficulty swallowing, a visible lump in the neck, or changes in a voice. Thyroid cancer is an uncontrolled growth of abnormal cells within the thyroid gland. It's usually detected as a nodule in the thyroid gland. Most thyroid cancers have a good prognosis and can be treated successfully, especially when they detected early. So diagnosis of thyroid disorders typically involves a combination of physical examination, blood tests to measure thyroid hormone levels, imaging techniques such as ultrasound, in some cases a biopsy of the thyroid tissue. Treatment options vary depending on the specific disorder, but can include medication, radioactive iodine therapy, surgery, or a combination of these approaches. Toxic goiter, also known as a toxic multinodular goiter or a toxic thyroid adenoma, is a type of hyperthyroidism. So I will be because there is a question of like this toxic goiter. So it's a type of hyperthyroidism characterized by the presence of multiple nodules of an enlarged thyroid gland that produces excessive amounts of thyroid hormones. So the name toxic because it's called toxic because the overactive thyroid gland releases an excessive amount of thyroid hormones into the bloodstream. The exact cause of toxic goiter is not fully understood, but it's believed to result from certain genetic factors and long-term iodine deficiency. In some cases, a single nodule within the thyroid gland, known as a toxic adenoma, may be responsible for the excess hormone production. So the symptoms of toxic goiter are similar to those of hyperthyroidism, actually the same. Weight loss, rapid or irregular heartbeat, nervousness or anxiety, tremors, heart intolerance, heat, not heart intolerance, heat intolerance, increased sweating, fatigue or muscle weakness, difficulty sleeping, changes in the bowel habits such as increased frequency of bowel movements. And finally, goiter, enlarged thyroid gland that may cause visible swelling in the neck. Diagnosis of toxic goiter involves a physical examination, blood tests to measure thyroid hormone levels such as T3, T4, and imaging tests such as ultrasound to assess the size and structure of the thyroid gland. In some cases, a radioactive iodine uptake scan or thyroid scan may be performed to determine the functioning of the thyroid gland and identify any areas of excessive hormone production. So treatment options for toxic goiter include, this is a management of hyperthyroidism, antithyroid medications such as metimazole, or propylitouracil, propylitouracil may be prescribed to reduce the production of thyroid hormones. These medications are often used as a temporary treatment to control symptoms before other definitive treatments are pursued. Radioactive iodine therapy. Radioactive iodine is taken orally and it's absorbed by the thyroid gland. The radiation helps to destroy the overactive thyroid tissue. Leading to destroy the overactive thyroid tissue, leading to reduction in hormone production. This treatment is often used when medication fail to control symptoms or as a more permanent solution. Surgery. In some cases, surgical removal of all or part of the thyroid gland, thyroidectomy, may be recommended. This option is usually considered when medications or radioactive iodine therapy are not suitable or there is a suspicion of thyroid cancer. So the choice of treatment depends on factors such as the severity of symptoms, the size of the goiter, the presence of nodules, and the individual's overall health. So I find a question that's repeating in several questions in your tickets. The main difference between hyperfunction and hypofunction of the thyroid gland. So this difference lies in the production and release of thyroid hormones, obviously. Hyperfunction, hypothyroidism, refers to an overactive thyroid gland that produces and releases an excessive amount of thyroid hormones into the bloodstream. It can be caused by conditions such as Graves' disease, toxic multinodular goiter, or toxic adenoma. In hyperthyroidism, the metabolic rate of the body increases, leading to acceleration of various bodily functions. Some common symptoms include weight loss, rapid heartbeat, anxiety, irritability, tremors, increased sweating, heat intolerance, and difficulty sleeping. Hyperfunction, obviously hypothyroidism. Hypothyroidism, on the other end, refers to an underactive thyroid gland that doesn't produce enough thyroid hormones. The most common cause of hypothyroidism is an autoimmune condition called Hashimoto thyroiditis. Other causes that can include thyroid surgery, radiation therapy, certain medications, or congenital factors, which hypothyroidism or the metabolic rate slows down, leading to a range of symptoms such as fatigue, weight gain, constipation, cold intolerance, dry skin, depression, and muscle weakness. Yeah, so in summary, hyperfunction, hyperthyroidism, involves excessive production and release of thyroid hormones, leading to an accelerated metabolism, while hyperfunction, hypothyroidism, involves insufficient production and release of thyroid hormones, resulting in a decreased metabolism. Both conditions can have significant impacts on various bodily functions and require appropriate medical management. Hashimoto's thyroiditis. So Hashimoto's disease or Hashimoto thyroiditis, also known as a chronic lymphocytic thyroiditis, is an autoimmune disorder that affects the thyroid gland. In this condition, the immune system mistakenly attacks and damages the thyroid gland, leading to chronic inflammation. So, autoimmune reaction. Hashimoto thyroiditis is the most common cause of hypothyroidism, resulting in an underactive thyroid gland. So, causes of Hashimoto is not fully understood. It's believed to involve a combination of genetic predisposition and environmental factors. Certain factors such as family history of autoimmune diseases, other autoimmune disorders, for example, type 1 diabetes or rheumatoid arthritis, and exposure to excessive iodine may increase the risk of developing Hashimoto's thyroiditis. Symptoms of Hashimoto is the same as hypothyroidism. Hashimoto's thyroidism often progress slowly over time. Initially, they may no noticeable symptoms at all. As the condition progresses, then the thyroid gland becomes more damaged. It can lead to symptoms of hypothyroidism, such as fatigue, weight gain, cold intolerance, constipation, dry skin, thinning hair, depression, muscle weakness, and memory problems. Diagnosis of Hashimoto thyroiditis involves a combination of physical examination, medical history review, and blood tests. Blood tests are conducted to measure thyroid hormone levels, including thyroid stimulating hormone, TSH, thyroxine, T4, and thyrotroponin, or thiodotronine. But there's three actually, thiodotronine. Okay.
Triiodothyronine. Triiodothyronine. Triiodothyronine.
So for me, it's absolutely unpronounceable. Actually, T3. In Hashimoto thyroiditis, TSH levels are typically elevated, while T4 and 3 levels may be decreased. Management. The primary treatment of Hashimoto's thyroiditis is a hormone replacement therapy with synthetic thyroid hormone, usually levothyroxine. This medication helps restore normal thyroid levels in the body. Regular monitoring of the thyroid hormones levels is necessary to ensure the appropriate dosage of levothyroxine. In some cases, if there is a goiter, enlarged thyroid gland causing discomfort or aesthetic concerns, surgery may be considered to remove part of all the all of the thyroid gland. No, all, it's not, of course, not aesthetic concern. It's important to note that the Hashimoto's thyroiditis is a chronic condition that requires lifelong management. With proper treatment and regular monitoring, individuals with Hashimoto can lead normal, healthy lives. Hypothyroidism is a condition characterized by an underactive thyroid gland, meaning the gland doesn't produce enough thyroid hormones. Myxedema, myxedema, yeah. On the other hand, is a severe form of hypothyroidism that occurs when the condition is left untreated or poorly managed for a long period. So myxedema is considered a medical emergency and requires immediate medical attention. Sort of the same hypothyroidism. So hypothyroidism can have various causes, including autoimmune disease, above mentioned Hashimoto, thyroid surgery, radiation therapy, certain medications, and congenital factors. The most common symptoms of hypothyroidism include fatigue, weight gain, constipation, cold intolerance, dry skin, depression, muscle weakness, and cognitive impairment. So diagnosis is made through blood tests that measure thyroid hormone levels, specifically thyroid stimulating hormone TSH and thyroxine T4. Treatment for hypothyroidism usually involves daily oral supplementation with synthetic thyroid hormone, levothyroxine, to restore normal hormone levels in the body. With proper treatment and management, most individuals with hypothyroidism can lead normal, healthy lives. Concerning myxedema is a severe form of hypothyroidism that occurs when hypothyroidism is left untreated or inadequately managed for a prolonged period. It's a more common in myxedema in older adults and can be triggered by factors such as infection, exposure to cold temperatures, certain medications, or trauma. Myxedema is characterized by what? By the accumulation of mucopolysaccharides in the skin and other tissues, leading to swelling, thickening, and puffiness of the affected areas. Puffiness. Symptoms of myxedema include extreme fatigue, lethargy, cold intolerance, slowed mental function, low body temperature, slow heart rate, low blood pressure, and in severe cases, myxedema coma, which is life-threatening condition. Myxedema requires immediate medical attention. Treatment typically involves intravenous administration of thyroid hormone replacement, levothyroxine, levothyroxine, and supportive care to stabilize the individual's condition. It's important to know that while myxedema is a severe complication of hypothyroidism, it's rare in developing countries due to early diagnosis and effective treatment of hypothyroidism. Regular monitoring and appropriate management of hypothyroidism can prevent the progression to myxedema. So it's crucial to consult. Everything is okay. So I suppose it's largely sufficient concerning thyroid dysfunction, thyroid disorders. So thanks for your attention, my friends. Re-listening this video several times. Don't forget about that. Don't forget to make the notes. Re-listening, and re-listening. Repeating is the mother of learning. So, my friends, see you in another lecture. Don't forget to follow and subscribe the channel. Not just put the subscribe. Follow the channel. So, God bless you. Bye. See you.